Assalamualaikum and hi, I bid to Banner Hairina and everyone who watched this video. In this video, our group will be presenting on the topic that have been given to us, which is breast cancer. Before we begin with our presentation, let me introduce my team members. The first one is me. My name is Balkis Zulaikha binti Adi Roskam. The next presenter is Nur Adriana Nisa binti Muhammad Fuad. And the last one is Putri Aini Shamimi binti Rashid. The contents that will be discussed in this video are introduction, etiology, complications, imaging modalities which are mammogram and ultrasound, radiological appearances, technical consideration, appropriate imaging modality, and the last one is conclusion. I will start our presentation with my part, which more focus on its introduction, etiology, and also complications. Breast cancer is a disease that occurs when there is uncontrollable growth of abnormal cells in breast, which leads to the formation of tumors. According to World Health Organization, WHO, approximately 99% of breast cancer cases occurs in women, and only 0.5% to 1% occur in men. This clearly shows that being female is the biggest risk factor for breast cancer. One of the main reasons breast cancer develops is due to high level of estrogen and progesterone hormone, which stimulate breast cells and cause them to grow uncontrollably. These cancer cells can invade surrounding breast tissue, and in severe cases, it spread to nearby lymph nodes and other organs, and this process is known as metastasis. Metastasis is particularly dangerous as it is life-threatening and can be fatal. Early detection of breast cancer is very important. Some common signs and symptoms include breast swelling, pain, nipple discharge, and the presence of a lump in the breast. So treatment option for breast cancer vary. It depends on the stage and type of cancer. So common treatments include surgery, radiotherapy, and also chemotherapy. I will start our presentation to discuss regarding the etiology of breast cancer. The development of breast cancer is influenced by a complex interaction of both changeable and also unchangeable factors. Etiology refers to the primary causes that trigger the formation of abnormal breast cells. So one of the major causes is genetic factors. Inherited gene mutation such as BRCA1, BRCA2, and PALB2 significantly increase a person's risk of developing breast cancer. Individuals with these mutations have a higher lifetime risk compared to the general population. So, the next one is hormonal factors. It plays an important role because prolonged exposure to estrogen and progesterone increase the stimulation of breast cells, which may lead to cancer development. This is commonly seen in women with late menopause or long-term hormone exposure. In some rare cases, environmental exposure may contribute to breast cancer. So exposure to high-dose radiation, such as radiation from nuclear explosions or radiotherapy at a young age, may directly damage DNA and increase cancer risk. Age is another significant risk factor. So according to surveillance epidemiology and end results, or SEER data, Women aged from 50 to 59 have a 2.4% risk. Those aged 60 to 69 have 3.5% risk, and women aged 70 and above have a 70% risk of developing breast cancer. Lastly, lifestyle factors also influence breast cancer risk. This includes smoking, unhealthy diet, alcohol consumption, and lack of physical activity. Unlike genetic and age factors, lifestyle factors are modifiable or changeable, meaning the risk can be reduced through healthy choices. Now I will move on to the complications of breast cancer. Breast cancer can lead to various physical and emotional complications. Common local complications include pain, swelling, and skin changes in the breast. So when the lymph nodes are affected, especially after surgery or radiotherapy, patients may experience arm swelling or lymphedema. If breast cancer spreads to other organs, it can cause serious systemic complications. For example, metastasis to bones may result in bone pain and fractures, while spread to nerves may cause neurological problems. In addition, cancer treatment themselves can cause complications. Chemotherapy and radiotherapy often lead to side effects such as fatigue, hair loss, nausea, and increased risk of infection due to weakened immunity.
So I will continue the video presentation with imaging modalities. So the first imaging modalities is mammogram, which modalities that very well known when it comes to breast cancer. Mammography offers high sensitivity, which is 75 to 80% by means it's very good in detecting early sign of cancer. So mammography actually can detect three main things. The first one is low-growing lesions that haven't caused any symptoms yet. Second, obvious breast masses, for example, solid lumps. And lastly, is the most important things is microcalcifications. Microcalcifications are tiny calcium that deposits at the breast area. It looks like a white specks on the image. They are often the first sign of breast cancer. However, mammography also has some limitations. The first one is if the patient has a very dense breath, the sensitivity of mammography definitely will drop about 50%. Also, this dense breath will interrupt the detection of lesions as it will cover all the possibility signs of the patient is having breast cancer. Next, please take a look at the diagram that I attached on the right side of the slide. So there are two pictures of breast under mammography with a different composition. As you can see, there is composition A and composition D. So composition A breast shows mostly fatty fat that will offer a very high sensitivity and easy to spot any lesion or signs under mammography. Meanwhile, for composition D is a picture of extremely dense breast, which I said before, it will drop out all the sensitivity that mammography offers. Discussing about ultrasound as an imaging modality in breast cancer. Ultrasound is considered as an essential follow-up imaging modalities after mammography. By means, to detect breast cancer, usually mammogram is not used alone as the first screening tool, but instead to further ultrasound is used to further evaluate the abnormalities that are detected on the mammogram. So one of the major advantage of ultrasound is that the effectiveness is not affected by breast density, which this is very important because dense breast tissue can reduce the sensitivity of mammography, making the lesions harder to detect. To add more, in such cases, ultrasound also plays a crucial role in guiding needle biopsy procedure. When a suspicious breast lesion is detected, ultrasound helps to accurately guide the needle to obtain the tissue samples. It is also used to assess a biopsy lymph node, which is very important for determining whether the breast cancer has spread to which part of the breast. Next, in terms of detection, ultrasound is particularly effective in identifying solid masses such as fibroadenomas or any malignant tumors. It helps to differentiate between the solid and cystic lesions, which is very important for diagnosis. It is also able to detect breast lesions that are invisible on the mammography, especially in patients with dense breast tissue. This makes ultrasound very important diagnostic imaging modalities when mammography findings are incapable. Additionally, ultrasound provides detailed information about the characteristics of a mass, including the irregular borders, abnormal shape, and also internal structure. These features can help to suggest whether a lesion is more likely benign or malignant. Next, for advantages, ultrasound offers several advantages, which is it is a radiation-free and very safe, which lead it very suitable for repeated use because it not involve ionic radiation, making it preferred imaging modality for women under 30 years old and suitable for pregnant patients. However, ultrasound also have some limitations, and one of them is it cannot reliably detect microcalcifications as mammography. Microcalcification is very important to detect whether the patient have early signs and best visualized using mammography. To conclude here on the imaging modalities, ultrasound is one of the best imaging modalities in breast to detect breast cancer. It is especially useful in dense breast for guiding biopsies and evaluating lymph nodes. But it cannot replace mammography due to inability to detect microcalcifications. Next, I'll be explaining about radiological appearance. This slide shows a radiological appearance of a breast cancer as seen on the mammography with a particular focus on microcalcifications, as you can see in the circle. On mammography image, microcalcification appear as tiny white specks scattered within the breast tissue, and it is usually very small, approximately 0.5 to 1 mm in size, which is why mammography is especially important for their detections. These microcalcifications are formed by calcium deposit within the breast tissue. Calcium itself is not harmful, and the pattern distribution and shape of these calcifications are clinically significant. From a clinical perspective, microcalcifications are important because certain suspicious patterns may indicate early stage breast cancers, and sometimes even before palpable mass develops. This makes mammography an important modality in early detection of how it's screening. However, it is also to note that not all microcalcifications are malignant. Some may be associated with benign conditions such as fibrosis, changing aging of breast tissue. This breast cancer will know after all the imaging modalities are done by the radiologist.
Hi, my name is Putri Ainisha Mimi. I will continue the presentation for the technical considerations. So it can be divided into two parts, which is the patient considerations and positioning consideration. First, let's take a look at patient considerations. Some patients have sensitive breasts, which makes them more prone to discomfort or pain during the procedure. This is important because it can affect patient cooperation and image quality. Therefore, patients need to schedule the examination during the least sensitive time of menstrual cycle to experience less discomfort. Next, patients with breast implants can obscure the breast tissue during the procedure, which can lead to produce artifacts on the image. Hence, it can interfere to produce an accurate diagnosis. Additionally, for patients who have acute mastitis or breast abscesses, are not recommended to undergo mammography, as the procedure can worsen the pain and the inflammation because of the pus and the swelling of patient breasts. So for the patient who experience acute mastitis and breast abscesses, the mammography procedure can be done after the infection has healed, or examination can be done or performed with other modalities such as ultrasound. Next, moving on to the positioning considerations. So in mammography procedure, it involves two typical views, which are craniocaudal and mediolateral oblique. In craniocaudal view, the patient's breast is positioned on the image detector, and the pedal will compress the breast from the superior to inferior. So first, the compression level should always be adjusted according to the patient's tolerance and breast size. Proper compression helps reduce motion and improve image clarity, but it should not cause unnecessary pain. Adequate compression and separation of the breast tissue are essential to ensure the entire breast is captured without any cut-off, which is crucial for accurate diagnosis. In summary, both patient comfort and correct positioning play a vital role in obtaining high-quality images and accurate diagnosis while ensuring patient safety. Now, I will explain the appropriate imaging modality used for breast cancer screening, which is mammography. So, mammography remains the gold standard for breast cancer screening worldwide because it is reliable and widely accessible. One of its main advantages is that it helps in early cancer detection, which often before the patient experiences any physical symptoms. In recent studies shows that mammography has an accuracy of about 85 to 90%, especially in detecting early signs such as calcifications, which are often the earliest indicators of breast cancer. Therefore, when breast cancer is detected early by the mammography, it is generally more curable and treatment options are more accessible and effective compared to the cases where the disease has become chronic. Thus, we can see that mammography plays a crucial role in early diagnosis, which improving patient outcomes and reducing breast cancer-related mortality. So, to conclude, mammography is an effective imaging modality for detecting subtle changes in breast tissue that may be associated with breast cancer. It plays a major role in early detection, which is essential for improving patient outcomes and survival rates. However, in some cases, mammography alone may not be sufficient. Therefore, additional imaging modalities such as ultrasound or MRI are sometimes used to complement mammography procedure, especially in complex cases or dense breast tissue, which is to achieve a more accurate diagnosis. In summary, while mammography remains the primary screening tool, a multiple modality imaging approach helps ensure better and more reliable breast cancer diagnosis. These are the list of the references that we use in the making of the video. That's all from us. Thank you for your attention and time.